We are pleased to have Ben Frank, the CEO of 3AIM Partners, with us today. Ben has had 30 years of experience in the healthcare sector, serving on boards, leading organizations as CEO, president, and system COO, among other senior positions. And today he will give us his insights regarding ways to solve the various problems in the current healthcare landscape, with an interactive Q&A session at the end as well. So welcome, Ben.
Katie, thank you much for the kind introduction. Really looking forward to the presentation and hearing the thoughts from the team today. Okay, so as Katie mentioned, I have over 30 years of healthcare experience, lots of wounds and lots of scars serving in a healthcare system environment for both for-profit, not-for-profit, academic medical center, as well as serving domestically and internationally. So I'm going to present to you from the lens of a health system and share with you my insights and thoughts around where there's opportunity and how I think you can really lend your technology to really help advance, as Katie mentioned, access points in the healthcare field. So as far as our agenda, I will go over healthcare landscape overview, just showing you some highlights around the US healthcare system, the challenges and opportunities that we face and that you face from a technology standpoint, the trending technologies of what's really going to help advance care for patients and for our citizens. Speed bumps. What are some of the issues that are not working as well, bringing technology to market and inside a healthcare system? Then how to enact change as a leader. And then lastly, we're going to talk about bringing this all together. What can we do as innovators, entrepreneurs, as leaders to really help advance healthcare throughout our United States healthcare system? And then most importantly, really looking forward to hearing your thoughts from a Q&A session. So what I'm going to do is present to you there's many statistics out there around the US healthcare system. But I picked out a few just to talk about to lead this discussion. So just highlights population over 320 million in the United States. These are the latest figures. 17% of our GDP, that's gross domestic product. And just for comparative, that is almost twice what other comparable nations spend from a GDP standpoint. So when you look at this, our spend, if you're spending that much more, you would expect to have a much greater access and much better outcomes just from the standpoint of looking at that difference in spending. We have 2.6 physicians per 1,000 population. This statistic ranks 60th percentile according to the World Bank. So as Katie pointed out, there's some great access opportunities here. And these are physicians. These are not APPs or advanced practice providers that are nurse practitioners, physician assistants, CRNAs, nurse midwives, et cetera. We have over 6,000 hospitals in the United States with over 920,000 beds with 36 million admissions. So the number I really want you to take away from this slide is the next one, our healthcare expenditure number. That is $3.6 trillion in healthcare expenses. Is that an investment or a cost? And of that, of our 90% of our 323 million, looking at of the population that's insured, that's 90%, over half is private. And the vast majority of the remaining is government, that's Medicare and Medicaid. So this just shows you the potential of 320 million population, what we have an opportunity for to bring access better and faster. I wanted to provide an example around the ecosystems inside healthcare, mainly healthcare systems. So you have Intermountain as an example. They're a payer and they're a provider. So they own hospitals, they own clinics, they also own a payer. And there's a term for that now called payvider. So that's a new term that we'll talk about shortly. Then we have an opportunity to explore someone outside of a provider and a payer, and that's a Cleveland Clinic. That is a private, non-for-profit hospital system. However, this hospital system started out as a physician practice that happened to own hospitals and expand. So very different model from Intermountain. And then lastly, HCA is the largest for-profit healthcare system out there. And some examples about payers, Humana has a big presence in the Medicare Advantage space. We all know that Aetna owns CVS. Cigna is very big in the pharmacy benefit manager space. And then we have Oscar. Oscar is a relatively new entrant that its focus is very different than the other payers. Then there's new entrants. And I could speak for hours going through names and I still wouldn't get finished. There's so many new entrants to healthcare today, and it's changing almost by the hour. And what I want you to think about the healthcare system is these systems provide care from prevention to end-of-life care. End-of-life care, you may have heard about, it's palliative care, hospice care, et cetera. So primarily patients are still attached to a healthcare system. However, that's changing. So some more statistics here from a performance standpoint. So going back to 17% of GDP, almost twice of comparable nations. However, we have the lowest life expectancy. We have the highest chronic disease burden and obesity rate that is 2 times higher than our comparable nations. We have fewer physician visits than peers in other countries. And we use very high-priced technology of having patients go into an MRI first, surgeries first, instead of other countries. Patients have to go through, call it certain care gates, physical therapy, et cetera. So going back to the $3.6 trillion, you would think that investment of almost 17% of GDP yields great outcomes, where in some areas it does, but you can see that there is a ton of opportunity here to redirect the expenses of that 3.6 trillion. And just think if we reduced 1 to 2% of that, that's almost $3 billion in savings by really not doing a whole lot. So I see a question there. Where does the money go? So the money goes to hospitals, to physicians. This is the total healthcare expenditures. So is that an investment or a cost? And there's a lot of debate around that. And that's a great question. I'm glad that you brought that up. What can we do by increasing awareness around that investment? So again, just a couple more points, just really quick. We have the highest number of hospitalizations from preventable causes and the highest rate of avoidable deaths. So we do a really good job of taking care of patients once they're sick, and that's higher cost. What can we do to focus on the prevention side? So we rank last in the measure of healthcare access and quality, indicating higher rates of amenable mortality in peer countries, very similar to the previous point. Where does the money go? Is it spent in the best place for patient outcome improvement? And lastly, we rank 4 out of 5 in categories comparing to high income countries. So smarter spending, not more spending, is required to achieve better health outcomes and performance. So what I mean by this, when you look at that $3.6 trillion expenses and you look at the stats that we just looked at, there is a great and momentous opportunity to redirect expenses to access that will improve patient care, that will extend lives, and really focus on the prevention of care. So the dollars spent are spent early on versus spending treating. So we want to see the money shift to prevention. That will reduce the cost of treatment. And again, all of us in healthcare, been in healthcare for 30 plus years, as Katie pointed out. Healthcare is about patients. It's about empathy. It's about connection. It's not about a transaction. It's not about what's next, what's coming next. This is about interacting and connecting with patients and ultimately making their lives better and healthier. Okay, so now we're going to shift to our next topic on the challenges today. So this is from a healthcare system clinical perspective. Is this the right time to build a value-based healthcare capability for a healthcare system? Partially, the answer is, from my standpoint, it's absolutely yes. we have to go and put more at risk. And by that, I mean, there's a fee-for-service system in place where you get paid for every episode of care. When you look at value-based capabilities, you're actually getting money up front, and you're supposed to take care of patients with that set allotment of dollars. So you're going to focus more on the prevention piece and how do you prevent emergency room visits? How do you prevent admissions? How do you prevent readmissions? How do you bring care to the patient? So a big question health systems face now is, do you go alone? Do you partner? And there's so many new companies out that are in this space of partnering, and they're bridging technologies for healthcare systems to leverage. If you think about the core capability of a healthcare system, is to take care of patients. Then you have technology, you have so many other administrative functions that are part of the healthcare system, where you as entrepreneurs and inventors and leaders are really going to look and identify ways to actually make it much easier for healthcare systems to partner and not try to go alone, because this is not the core business. The core business is taking care of patients. And based on a number that we've seen, we have a long way to go to get a better return on that investment, and that's better health. So we want to advance the quality outcomes and remain efficient and relevant. So you have some healthcare systems that are yet smaller. Are they relevant in today's market? Do they have the right technology? Do they have the right access points? Do they have the right to the next point, the digital front door, the digital access points for patients and even other providers to access? So if you want to go to your phone and say you are part of a system that has Cerner, that has Epic, and you can go to your MyChart app and schedule an appointment. You can get a prescription refill. How easy is that? How easy it is to schedule an appointment. So it's unbelievable the opportunities that we have as a healthcare system to make it easier for patients to access. And just a point I'd like to bring up, this was something in the past where it was almost bragging rights. The longer the wait you had as a healthcare system for patients to access you. Say you're a physician and it took 2 months for a patient to get in. Today, not so much, right? It's about access. Patients have many more choices, and they're going to vote with their fingers and schedule an appointment elsewhere, or vote the feet, walk into another area and be seen much faster. So healthcare systems are realizing this, much slower though than other companies that are much more nimble and can pivot to adapt to technologies. So what solutions already exist? Healthcare systems are looking at, what do we have inside the healthcare system? Why are we different? What makes us so different from our competitors that patients are going to choose us time in and time out? So what do we have that they become sticky and they don't leave our healthcare system? Not a lot of systems are thinking like this, and this is where you're going to see in a future slide the opportunity of this $3.6 trillion expenses is being gnawed every single day and redirected into new companies. Another point from a healthcare system, and I sat in a seat of looking at how well can the team articulate the company solution. So when you're sitting in front of a group of healthcare executives and it's 5 minutes, 10 minutes into the presentation, and you're not able to articulate your solution, how it can help, it's really, really hard for a health system to stay focused in that conversation. The attention span is relatively short. There's so many things that happen day in and day out in the healthcare system where I'm imploring you to grab the attention right out of the gate to the health system leaders and talk about why you're different, and make sure that you and your entire company can talk about that and be very articulate into your solution. And healthcare systems want to know that if they make an investment in using a new technology, that the company is financially stable and sustainable. They don't want to invest and spend a lot of effort and the company just not have the financial wherewithal to continue. Okay. So some trending healthcare technologies. Again, there's so many statistics out there, but this one really resonated to me as I read it. According to a recent PwC report, 77%, so that's 3/4 of the clinicians who they surveyed, said that new non-traditional care venues, which is retail clinics, concierge clinics, on-demand health, just to name a few, are either maintaining or improving patient health outcomes. So when you look at traditional avenues, that's a healthcare system. Now, the vast majority of clinicians are seeing that new access points are not only maintaining, but they're improving the health of patients. And they will continue to improve the health of patients as they navigate a system that's outside a healthcare system. Maybe it's much smaller. Maybe it's a single company who has multiple primary care locations that provides 7-day-a-week access, 24/7 virtual care. They provide care management services. So this is where the business of the healthcare system is being chipped away hour by hour every single day. And when you look at the vast scope of the healthcare system space, you go from preventive care to primary care, behavioral health, which is an unbelievable opportunity these days. If you see how many healthcare companies are investing in behavioral health or these standalone, just really, really innovative companies that provide the access on behavioral health it's stunning. Acute care all the way to aging at home. That's a new concept in senior care where elderly patients are being treated at home. This is a hospital at home all the way to comfort care. So longitudinally, I want you to understand that there is significant opportunity in all of these levels on the care scale. Okay, so I wanted to point out just a few areas of opportunities I see coming from the health system side, and some of the clients that we're working with now are virtual access points. These are access points through your phone, through your PC, 24/7 access for primary care, pediatric care, urgent care, to where before maybe you saw a physician from 8 to 5 Monday through Friday, and that was it. Now care is 24/7, 24 hours a day, 365 days a year. And there's many companies that are popping up every single day that are taking patients away from a healthcare system because they're providing better access. So remote patient monitoring, also known as RPM, to hospital at home. Had a call earlier this morning about hospital at home where a healthcare system is actually looking to admit patients from the emergency room setting into the home. So not even going into the hospital, they have to meet certain criteria where they're going to have a team who actually admits the patient at their home. They set up monitoring, and the patient's monitored for their couple of day stay, and they're quote discharged. So they don't leave the home once they're admitted quote in the home. So it's a great concept, and that concept is only going to take off if you look at the cost of the real estate from a healthcare system. You have many patients who could be treated at home, and it's much less risky from an infection standpoint. So I mentioned the digital front door of looking at how patients access the healthcare system. Great opportunity here on access and ease of access. Value-based solutions. These are solutions where systems will look to diversify revenue into value-based healthcare streams, meaning instead of getting paid for every single visit, they're going to get paid a lump sum per patient per month, also known as PMPM, to take care of patients. And this is where the analytic piece from care management is going to be absolutely critical to how you put the technology in the hands of care management to navigate the care from the provider. So think about the provider being a quarterback, and that's a physician or an advanced practice provider, nurse practitioner, where they are very engaged in every step along the way in the patient's care journey, where prior that really it just didn't exist. And precision medicine, genomics. So when you look at profiling, say yourself or family history, like my father, he has chronic heart failure. So I'm at risk genetically for having heart issues. So I know that now, excuse me, I'm very active in looking at how I can not fall in that lane where I have heart failure. So I'm eating better, I exercise more. So I know that from a genetic makeup standpoint, that now we have this technology and based on lab tests, based on other testing, where you can get ahead of this and you can take ownership of your health much faster than you could before. And lastly, medical devices. And I've seen a lot of movement with a physical medical device being a technology for a company. But now we're seeing that there's a lot of medical devices that exist, and the IP, the intellectual property, can actually be moved in an algorithm format into a medical device. So all of a sudden, instead of looking at having to create your own medical device, maybe it's easier from a technology standpoint to take that IP and integrate into a partner solution. So I wanted to point out here the trending healthcare technology. So I mentioned just a few in the previous slide. This is from the CB Insights Digital 150. Just take a look at this slide. If we would have looked at this 3 or 4 years ago, it would look a lot thinner and have a lot less companies on here. So I'm asking you as a healthcare leader, entrepreneur, and innovator, to when is your company going to be on this slide? Of looking at what you're doing to make such a great impact in healthcare, where do you see yourself in 3 to 5 years? So just look at all the different segments: administrative and automated functions, clinical intelligence, as we talk about value-based healthcare, health management plans and benefits. That's where you see Oscar. You see the virtual care delivery in the bottom right. So all these companies have spent the time to look at how do they get a piece of that $3.6 trillion pot of money that's being spent. And they're doing really, really great jobs and great things for patients by providing that greater access. And going back to the PwC quote, it's not only maintaining health, it's making health better. Okay, so let's move to the next slide. So again, just another slide showing on the far left, if you look at some really big names, Qualcomm, Anderson, Google Ventures, some of the investments that they're making in these technology companies. So, and it's not small dollars. So again, everyone's realizing that that 3.6 trillion is up for grabs. And they're looking at this because healthcare systems at times aren't moving fast enough. They're not as nimble. So a couple questions I really want to leave you with and to challenge your team with. So 5 questions from a health system perspective. So somebody who is looking at your company. And those questions are, what problem are you trying to solve? I think ultimately that's what we ask ourselves every single day. What is the problem that we're trying to solve? How is that going to impact care? So who is or are the right customers? Is it the healthcare system? Is it the provider? Is it the payer? And this term now, payvider, right? So payvider is a payer and a provider. Or is your customer the patient? So if you look at some of these standalone primary care clinics in underserved neighborhoods, maybe that is your customer. It's directly to the patient who's underinsured. Or is it employers? All of these groups have much different incentives. They're looking to solve problems in a very different way, and they're looking at different outcomes. So as you look at your technology and the team, really think about what you're focused in on, from what problem are you trying to solve and who does it ultimately impact? And what solutions already exist? So going back to that CB Insights slide, you see there's not one company in these sections, there's multiple companies, and that just highlights a few. So if you're in that box of 50 companies, why are you different? What makes you different that a healthcare system is going to want to have you attached to them to really drive healthcare access and better outcomes? So, and it's how well can you and the team articulate that company solution, right? I think this is a really, really important one to ask yourself and reflect on it. I do, coming from 3AIM, if someone asks me about 3AIM, I know I need to be extremely crisp on what 3AIM does. And the expectation is, talking to other companies who we represent, that they do the same, that you have that quote, the elevator speech, where you have 30 seconds to a minute to articulate very succinctly what your company does and the impact it has in the healthcare space. Again, going back, are you financially stable and sustainable for scale and design? So let's say it's a great problem to have. If you have a lot of demand for your technology, are you able to scale it fast enough based on your financial resources? On how do you design the scale? This is something I've spent time on in different healthcare systems, is some of these organizations actually have a design structure inside innovations. And the design structure is built, how does it fit today? And how do you scale it over time? How do you make sure that it is seamless? And then you think about many different ways to actually scale and implement certain services. Okay, so we're starting to package this from the US healthcare system standpoint. You saw the stats, you saw the opportunities. Now you're looking at, how do we look at changing? How do we look at leading change in this really, really impactful environment? Do you have the right people in the right lane in your organization? It's going to be really, really insightful for you to take this exercise and really think through this. If you have a company of 3 people or 100 people, do you have the right leaders in the right lane? And do you have the right upward and downward type of dialogue and focus? So you have a board who you talk to most likely, and does your team underneath you understand, and do they have the right focus? So that board dialogue is so important from the standpoint of, how are you talking about growth? How are you talking about challenges? How are you talking about opportunities? How are you talking about growth? That your team feels the same way, that everyone in your organization knows what the focus is, and they know what the right job is that they're responsible for. Do you have the right mentors and advisors? We all have mentors and advisors. I have 3 that I deal with almost at least once a week, if not more. These are previous bosses of mine who I lean on a lot, who were there for me when I was just starting out. And I lean on them for everything, personal as well as business, right? It's great to have someone who can talk to you about mentoring from a business standpoint, and maybe some personal challenges as well. As well as advisors, we serve as advisors to other companies, and we have advisors in our company. So these are thought leaders who you could really have that in-depth conversation, that challenging conversation where you're seeking for advice. This one is really, really, really one to think hard about. But are you capable of making the right decisions? But they're really hard decisions. I've had to do this as a leader. We all have had to do this in the past. And trust me, it never gets easy. When I brought in friends to an organization and I realized after 6 months they weren't the right leaders, I would try to find another role for them. If that didn't work, I would have to have that critical conversation and talk to them about why they're not going to be part of the organization anymore. So it's really, really tough, but I implore you to don't hesitate on some of these decisions. Talk to your mentors, talk to your board, talk to your advisors about some of these decisions, because they can impact your ultimate success of your company. Getting back to the messaging in previous slides, is your message clear and succinct? Are you able to crisply articulate your message to where there's no hesitation? You know exactly the technology and the impact that you're going to bring to the healthcare sector. And lastly, are you and the team nimble enough to pivot? Right, I think this is really critical. Going to that CV Insight slide, let's say a company has a new technology and it's great, and your technology is not there yet. Do you double down on your technology, or do you say, hey, as a team, we're going to do something different? We're going to get involved. We're going to pivot. We're going to leapfrog this company and do something very different. Where healthcare systems, they're really not that nimble. They want to keep doing the same thing, most likely. And there's other ones like Intermountain, who is the most innovative, think, system out there that is just incredible. They test the metal almost every single day on doing things in a different way. And they can back their decisions up by outcomes. And they pivoted. So I think this is where, from a courage standpoint, we as leaders, we need to have that courage. We need to have that confidence in talking to our team to say, it's okay to pivot. It is okay that we're going to look at something different and we're going to change our lane and we're going to be a better company for it. Okay, so let's move to the next slide. Katie, please. Okay, I'm really looking forward to your Q&A, but last slide, we're going to bring this all together. The opportunities are enormous. They're more than enormous. They are absolutely incredible. This is the most exciting time to be innovating in healthcare. If you think about how fast things are moving, how fast patients' expectations are increasing, patients want better outcomes, patients want better experiences. And when you look at the number of a population of over 320 million, that's a pretty big number of influence. So we as a healthcare system, you as healthcare leaders and entrepreneurs are going to be successful. But who's going to win the race? Who's going to jump in? Who's going to have the courage? Who's going to lead the team to actually show that your technology and your leadership is better than others? The impact you will make to provide patients a better experience. And lastly, the impact you will have on accelerating better health. So going back to healthcare, it's not about transactions. This is about patients' lives. This is about what you're going to do to leave a legacy and what you're going to do to really be proud of. We all have personal stories of healthcare, good and bad. But what is your story of your company going to mean to you in 10 years? What is your legacy? This is about patients' lives, who we can impact. If we're investing 17% of our GDP and that cost is 3.6 trillion, and let's say it's 10 years out and it's 3.6 trillion, and we're spending 10% of our GDP and our outcomes are better than our peer countries, that would be a great outcome, right? That would be that we're investing wisely. We're investing in patient lives. We're showing decreased mortality. We're showing decrease in patient admissions, and ultimately better health. So I'm asking you, I implore you to go out there, make a difference, impact lives, and do what you can every day to change the world and make it a better place for patients. All of us on this call, we're healthcare users, right? So go out there and change the world for us. And that's what I have for you today. So Katie, thank you so much for driving the presentation. Really, really appreciate it. And let's open it up to Q&A. I think there were some questions as well that maybe we can go look at real quick. So I'll just take a quick, David asked a question about CVS and where does money go? Then Chuck asked something about CVS owns Aetna after their merger, right? So it is a really interesting concept of a pharmacy, as you say, and an insurance company to come together. I believe this is a really, really critical showing of courage, of looking at marrying a standalone pharmacy company, right, 5 years ago, CVS, and a payer. And what I think that they're going to do is further disrupt from access. If you look at CVS, as I think that there's probably a CVS within 10 miles of where we all live in the nation. They're providing care closer to patients' home. They're going to get patients sticky to CVS. And if they need an insurance change, they're going to think about Aetna. They're integrating care. That's an intersection that was coming. And they're betting the intersection is going to yield stickiness to not only insurance, but to the overall pharmacy. And CVS is talking about maybe they do dialysis in some certain areas. So this is dialysis in a pharmacy. Who would have thought, as you're passing the candy aisle, that you're going to see a dialysis station? So This is where the industry is going. It's the intersection coming together. It's the courage of saying that we're going to take two companies that are very different and they will intersect at some point, and it's going to make absolute sense to why we merged an insurance company and a pharmacy. So when I look at David's question again, do payers, insurers take a big portion as well? So if you think about Medicare and private, that's 95% of our insured population of the 90%. So patients pay premiums, that goes into insurance companies. Insurance companies pay providers. So insurance companies make money if usage is less. So providers are now partnering too with insurance companies to see how they can have more of that balance. And if they share in if healthcare is actually, if utilization is less and there's better outcomes, how can a health system share in that? So that's where the bulk of the money goes. It goes to a payer, then the payer pays a provider. Or if you're in a risk arrangement, the money goes from a payer to a provider, and call it that the provider is actually capped, meaning now the risk is shifted to the provider. So the provider takes that risk, especially if it's 100% risk. And there are private companies out there that are taking on 100% of risk for everything that a patient has. So if you're going to do that, you better have the right care management functions, the analytics, and the resources to take care of patients to yield better health outcomes. Any other questions? Let's see. I see one. United Health is number 5 on the Fortune 500 list. CVS is number 4. McKesson 7. AmerisourceBergen 8. Right. Then you think another area that I didn't mention is Optum. So Optum employs, they're the largest physician employer in the United States, or United. They have an unbelievable analytics platform. So when now you employ that many physicians across many specialties, you have the analytics, they're going to be a driving force of acquiring more companies even faster. So you have many of these insurers who are investing in companies left and right to actually yield better outcomes, but it's going to be the same premium. So there's going to be a higher margin on the premium from the insurance perspective. But think about this all from an access perspective. The access is going to be the biggest key to success. How you provide access and how you follow up on the access. David, great question. In my opinion, it's more of a narrower focus. Again, it gets back to what problem are you trying to solve from a technology standpoint. Healthcare systems are trying to solve a lot of problems at once, and they have a lot of scale and they have a lot of scope. And I think if you look at a narrow focus on a very focused problem, that would be my recommendation of looking at that from a perspective, what area of healthcare can you impact? And if you really start to broaden that, it brings a lot more complexity into it, and it may take a lot longer to try to solve. So I think it's looking at that narrow focus is my recommendation.
Awesome. And then the next question is, what are some public policy challenges in these opportunities?
I could talk for about 3 days on the public policy and changes. So I think it's where we're going as a government on providing access. So if we look at Medicare and CMMI, and that's the innovation arm inside of Medicare, of really pressing for just let's try it legislation instead of going through where something takes a couple of years, can we get waivers in place to actually do services? It's like hospital at home. Hospital systems are actually getting waivers to actually bring services faster. So we need to take the time frame it takes to get something passed in a regulatory phase to really let's just try things and show results. So I don't see that changing, unfortunately, anytime soon. But the more advocacy that's out there, the better that we can get something to try it, right? Let's get the government and the policy and the decision makers give us the ability to try and give us the ability to do it. I really see that coming out of CMMI in the next year as they've done through direct contracting and a few things. So it's coming, it's just not coming fast enough. So there's a significant amount of opportunity there. And you're going to see a lot of investment in lobbyists to influence that. So the time period is greatly shortened.
Awesome. And then a similar question to that, Shaq asks, how much political pressure do you foresee on the healthcare industry to control the rapidly increasing 3.6 trillion investment/costs?
It's enormous. So when you look at, if you're in government and you get asked the question, as a country, we're spending 17% of GDP and it's 3.6 trillion, yet our outcomes are less than desirable at times. There's a lot of emphasis on there, and it's coming, where services will not be paid for if outcomes are below a certain level. So no one may be taking risk, but they're going to be a risk. Think about the readmission risk of 3%. So if patients, if they get readmitted to a hospital, money's actually taken away. I think that is going to be coming, Chuck. That's a great question, which that's a way to influence cost. You just don't pay for something if the outcome is in a certain range. So, and especially if you moved into the value-based world, you get paid a set fee. And if you don't manage care well, you're not getting any more money for that care. So it has to come from someplace. So there's going to be a lot of focus on just say no pay or reduce pay for certain outcomes. Let me skip to Sunil's question, and then we will get back to Kevin's. So is AI playing a role in healthcare? Absolutely, AI is, but it depends how you define AI. Is it artificial intelligence or augmented intelligence? Right? I think augmented intelligence can really help clinicians make decisions. I think that ML or machine learning is starting to play a bigger role than AI. I mean, AI is based on predictability, but if you look at machine learning, how a machine can take something and learn every single day from a predictive standpoint, working with a company now who is predicting emergency room volumes, and it's based on external inputs, 15 to 20 external inputs. And it's fascinating how the machine can learn. It's not actually making decisions, it's making recommendations. So I think it's all how you use on how you define AI or machine learning. It's here. It's to the point that it's actually used in making decisions for healthcare. Let's see. So Kevin asked another question. Are there health systems that have told us they do not embrace outside technologies? Okay, Kevin, I know where you're coming from. So I sat in this seat a couple of years ago, and I would say that we could do it all as a healthcare system standpoint. We don't need anyone else to help us. And look at where health systems are today. They can't do everything. They need to find partners that can bring technology faster, that's more reliable. Again, if you think about a healthcare system, how many millions of moving parts there are in a single day. Someone may have a great idea. They may want to try a new technology and it falls off the priority list. So you're spot on. So healthcare systems, hey, we don't need you as a outside technology, as we can develop this ourselves. It's that make versus buy standpoint of, well, we can go ahead and just make this ourselves and it takes us 3 years. Or if we can look at a company, say, Kevin, you're running a rev cycle company, that you can bring a solution in much faster in say 3 months. And it's much less costly and it's yielding better outcomes. So health systems, in my opinion, are going to have to embrace technology that's developed outside their healthcare system more than ever and do it much faster. If not, someone else is going to beat them and they're going to lose. Again, they're not pivoting fast enough to realize that there's better technology out there. And that's a great lesson learned for healthcare systems. If you look at that CB Insight slide, so many other companies are doing it better than what hospitals thought that they could do. Great question, Kevin. So we have have an anonymous attendee. So now I see the questions, Katie. Will no pay or reduced pay affect underserved or severe disease population? No doctors will see hard to care patients. So if you look at recently, there are clinics that are popping up in underserved areas. And you'd be surprised how well these clinics are doing. They're either at-risk clinics, meaning is they're getting paid per member per month to take care of patients, or patients are paying a reduced out-of-pocket fee. So when you look at the 90% that are insured and the 10% that are underinsured, there's patients in the middle that have insurance that are underinsured. So I see that these, call it neighborhood clinics, or these clinics in underserved areas, the medical home will only become more popular, and they will be funded from very different sources. So I see this as a significant opportunity. And these are patients who have not sought healthcare in the past, who now have access. So you're moving from that treatment of a patient that may have 5 chronic conditions to how do you get ahead of that and bring health to that patient in their neighborhood. So I think this is only going to be more and more prevalent of companies going into these areas and investing in the communities, yielding better health. Be about out of time, but I hope for everyone that attended, this was insightful from the lens of healthcare management, clinical management today, on what the expectations are moving forward. There's a tremendous amount of opportunity, and I really appreciate your time and attention this afternoon and great questions.